So eczema in general, the main things I look at: one, gut health; two, histamine levels. Eczema is a byproduct of too much histamine. So we have these white blood cells called eosinophils. And these eosinophils, they respond to things like allergens or parasites or candida or whatever it might be, and just allergens in general. In all eczema patients, I see that eosinophil number, which is a percentage of white blood cells that should be about 1 to 3%. And every single eczema patient, I will see that eosinophil number elevated, high. Sometimes it can be 11%. Sometimes I'll see it up at like 25%, which means that 25% of your white blood cells
fire
are those eosinophils, right? I will also see something called immunoglobulin E, or IgE, that is elevated in those kids or adults. So I use that as a marker to then know that the system is decreasing over time and chilling out over time. It doesn't give me an answer. I already know that. I'm already expecting that. But it's a good way to tell me that over time things are working and settling down.
Yeah.
So I use that as a marker. Then the question is, okay, what's provoking them? And that is where I start with the GI tract. Why? Because we digest histamine in the GI tract. We break it down there. So
imagine that.
Yeah. So if there's anything going on, if you're dysbiotic in any way within the GI tract and you're having trouble simply just breaking down histamine there, then it can accumulate and cause that threshold to be elevated, where now we're more reactive to everyday things in life, like foods, like inhalants, like environmental allergens.
And when you have one and you pile on others, the other things that may not have been such a histamine reaction are higher because you're putting it on top of
exactly
all the other things
it's
that are
like
happening.
The little cherry on top.